Hello, and thank you so much for inviting me to present on, of course, one of my favorite topics, which is human papillomavirus or HPV prevention and where we're at here in 2026. I'm Dr. Anna Giuliano, and I direct the Center for Immunization and Infection Research in Cancer here at the Moffitt Cancer Center in Tampa, Florida. And I also have the privilege of being the president of the International Papillomavirus Society. I always like to start with my disclosures. I have done a lot of work with Merck and their vaccine program, starting from the very beginning in 1999 and now expanding out to therapeutic vaccines directed against HPV. Okay, so who can get an HPV infection? And this is probably one of the most important questions that I get. Well, the first is that anyone can get HPV. This is one of those equal opportunity infections. HPV is spread through skin to skin contact. So what we say is that any kind of intimate sexual encounter could spread HPV. And in fact, what we find is that around 80% of people will have developed an HPV infection at some point in their lifetime. The good news is that most people will clear the infection on their own with their own immune system. But the bad news is that not everyone does. And the problem is we're not sure who is going to persist and who is going to clear the infection. If somebody persists, they're at greater risk of having that infection progress to a precancer or to a cancer. So at the moment, we say worldwide, 5% of all cancers are caused by HPV. So that's 1 in 20 cancers that are diagnosed worldwide are caused by human papillomavirus. And because of this, you can imagine the costs involved in detecting the cancers and treating the cancers. And it's over $10 billion are spent annually in the United States alone to diagnose and treat HPV-related cancers. So this is a family of viruses. It's one family, but many viruses in the family. In fact, there's over 100 different HPV types, but most of those do not cause disease. The cancers that HPV causes are mainly caused by 7 HPV types, and those are listed here. So 16, 18, 31, 33, 45, 52, and 58. It's also important to note that this is a very ancient family of viruses, and in fact, every mammal species has their own virus. So for instance, it wouldn't be human papillomavirus if we're talking about a dolphin, but it would be a dolphin papillomavirus or a cow papillomavirus. So it is a family of viruses that are very common to all mammals. And again, most of these infections do not cause disease, but these that I've listed here on this slide are the really important ones. And the good news is these are the ones that we have a vaccine that protects against them. Okay, so how common are these cancers that HPV causes? Well, first of all, we need to understand that it's not just cervical cancer and it's not just women that develop infection with HPV and get cancer. HPV causes 6 different cancers in both men and women. And you can see here in the pyramid, when we look worldwide, that the bulk of the disease is cervical cancer in women. But right above that are head and neck cancers, and specifically oropharyngeal cancer, which causes a cancer of the base of tongue and the tonsils. This cancer, unlike cervical, is primarily a cancer of men. As you can see, the number of men infected with this and suffer from this cancer is around 5 times greater than the number of women. HPV also causes anal cancer in men and women, penile cancer in men, vaginal and vulvar cancer in women. And what we say is that there are over 100,000 non-cervical HPV-related cancers that are diagnosed each year. And likely this is an undercount because most countries in the world don't have the benefit of the cancer registries that we have in the US and Europe. So we think that especially these head and neck cancers are undercounted. Now, all of these cancers are increasing in incidence, except cervical in most countries. In countries that don't have screening, cervical cancer incidence also is increasing. So, what about the United States? Well, now our pyramid looks different. Now you can see that the largest number of HPV related cancers is the oropharyngeal cancer, and that's the cancer that primarily affects men. And you can see now that the number of men diagnosed with oropharyngeal cancer caused by HPV is larger than the number of women diagnosed with cervical cancer. So this tells us a lot about the need to vaccinate and prevent HPV infection in men as well as in women. Or said another way, it's important to vaccinate our young boys, our adolescent boys, the same way we've been vaccinating our adolescent girls. So oropharyngeal cancer is the most common HPV cancer in the United States, followed by cervical cancer. Now, the problem with oropharyngeal is that we don't have a way to screen for this cancer before it becomes a cancer, like we do with cervical. So the best we can do is to vaccinate, to prevent the infections that cause the cancer, and to continue to do research to develop methods to detect the cancer early, similar to what we do with breast cancer, so that people who are diagnosed have a better chance of being efficiently and effectively treated and have long-term survival. So what is happening with those non-cervical HPV-related cancers? And you can see here that almost all of them are increasing in incidence, and especially anal cancer in women and anal cancer in men, as well as vaginal and vulvar cancers. And we look at oropharyngeal cancer, it's a much worse picture. And here I'm showing you data for oropharyngeal cancer among men in the United States by age group. And you can see by these numbers is the percent annual increase of the cancer each year. So what does this mean? So among men who are aged 50 to 59, we're seeing that every single year there's a 2.7% increase in the number of men that are getting diagnosed with this cancer. And in the age group 60 to 69, there is a 4% increase each year in the number of men and the rate at which men are developing this cancer. So these incidence rates actually are now higher for these older age groups than cervical cancer among women. So, but what about cervical cancer? I've made it sound as if it's a cancer that's disappearing. Well, it has decreased quite a bit since we introduced the pap smear in the 1950s and since we've advanced our methods for cervical cancer prevention. But not everybody in the United States is actually benefiting in the same way. So if you look at this map and you look at the dark colors indicate where the incidence of cervical cancer is highest. And it's very clear that it's highest in states like Florida, Alabama, Mississippi, Texas, Arkansas, Louisiana. The southeastern states have the highest incidence of invasive cervical cancer. Now remember, we have the methods to prevent this cancer. So it really is disheartening to see such disparities that are geographic disparities. Whereas in the New England area and in the Dakotas, you actually see much lower rates of cervical cancer.